It's 2026. Why are women still getting things wrong about their own bodies?
Clitoral structure wasn't first mapped until 1998. That is in my lifetime.
Should I buy special intimate wash for my vagina?
No! As a doctor who works in sexual health and I'm examining women all the time, nobody looks the same.
What is the symptom that women tend to dismiss that you really wish that they would get checked?
The whole skinny talk thing, it is so sad because it's just a cycle that's kind of repeating itself.
Petition for everybody here to start talking about their vagina and vulva the right way. Before we get started, I've just got a quick favour to ask you. If you aren't already, please could you press follow or subscribe wherever you're watching or listening? And if you enjoy the episode, could you share it with a friend? It really helps me create more podcasts and reach more people who need this information. Thank you so much and enjoy the episode. Hello and welcome to this episode of Too Much Information. Today we are talking all about a topic that I think is very important, which is it normal what every woman should know about her body? Today I'm joined by Dr Amber Savary-Trathen, who is a doctor, researcher and content creator specialising mainly in sexual health. Amber, welcome to the podcast.
Thank you so much. What a lovely welcome. It's lovely to be joining you on your podcast because I've listened to a few of the episodes and they're great. And Becca and I, who I do my podcast Taboo Topics with, are having a bit of a pause at the moment. So it's nice to be back in the podcast studio.
Yeah, I love that. Amber, I would love you to start us off by telling us about yourself. Who are you? What do you do? Why do you do it?
I'm Amber. I'm a doctor. I work in internal medicine in the hospital and have a special interest in women's and sexual health. That is my real passion, and I'm hoping to be a consultant in that area one day. So I split my time between clinical work in the hospital, research, and outside the hospital, I make videos trying to make women's health, sexual health less awkward and more honest so people can feel empowered about their bodies, empowered about their health. And then, as I've mentioned, I've got the podcast with Dr. Becca called Taboo Topic Pod. It says it in the title. We're trying to break down all the questions you might discuss with your friends, you might Google, but you never really get to the bottom of. And we also talk about sort of gossip and dating life and stuff like that. But we're trying to make it just normal to talk about these things.
As soon as I saw one of your videos, maybe 6 months ago or something, I was like, oh, this is like a dream guest because it's everything that I agree with and everything that I'm hoping to also slightly impact through this channel and this community too. So I'm just
absolutely
can't wait. You sent over a bit of information about your background and there was a word in there that I'd never seen before, which was genitourinary medicine.
Yeah, that is the fancy word for sexual health. We call it GUM. And there's a campaign called Love GUM to try and encourage doctors to go into that area. But no, I love the specialty. It's so interesting and it is a very empowering specialty. I think a lot of the people that work in it are really passionate about the topic and making people feel comfortable in their bodies and about their bodies.
Why did you decide to go into that specialism? Was there like a eureka moment or did it happen naturally?
I don't think there was a eureka moment. I thought by the end of medical school that I would know and I still didn't know. And then my friend was like, have you thought about sexual health? Because he was doing it. And I was like, no, actually, I hadn't. So then I went and worked in that for 6 months and I loved it. I absolutely loved it. I think it was a mixture of the team, as I said, the people you're working with. You meet someone, a patient comes into your clinic, you've never met them before, and automatically they are opening up to you about things that they maybe haven't spoken to anyone about before. It's a real privilege to be in that position and I think it shouldn't be taken lightly. And hopefully I'm able to do that well and make them feel at ease and comfortable. And then often by the end of the consultation, you've got a diagnosis. We take swabs, we look under the microscope and we can often see what's going on. And that's really satisfying because you can say, listen, you've got this, we're going to treat it today. And, you know, you can send them on their way. The other big part of my job is hospital medicine. So I'll be a consultant in both of those. So I've got a real mix and I love that as well.
Love it. That sounds great. And I can only imagine that for those people who are really mustering up sometimes the courage to go and see a medical professional, it must be so reassuring for them to meet somebody like you. What I'm hoping that we're going to get into today is some of these topics which we kind of live with for weeks or months or years without knowing the answer, and that we're forced to only go to Google or ChatGPT to ask because there is this stigma surrounding them.
Yeah.
But I'd love to start by asking you a big question. It's 2026. Why are women still getting things wrong about their own bodies?
Yeah, I think that's a huge question. And it's one that I did a talk on recently, actually. I think it stems back hundreds and hundreds of years. I mean, if you go back, we've always studied women's bodies through a reproductive lens. And, you know, we've done things like mapping the uterus, we've looked at fertility, but we haven't actually taught women how their bodies work and about their own anatomy even. I mean, the lack of anatomy teaching in schools when we're doing sex education, I don't remember being taught about the structure of the clitoris, about my vulva, none of that. If you don't understand your own body, how are you supposed to communicate with partners, for example, about what you like, what's important to you, if you don't understand it yourself? I mean, the clitoral structure wasn't first mapped until 1998, I think it was. That is so recent. That is in my lifetime.
That's younger than me.
Isn't that mad? If it's that recent that we've mapped the full structure of a big part of our anatomy, it's no wonder that we don't understand our own bodies. And you think, oh, well, I don't know my body. I don't understand my own body. And then it leads to that shame that comes with that. So I don't think it's any individual person's fault because you haven't been taught that. And then that kind of filters into society's view of everything.
I think that is a very, very good response. And it's easy to think about all of these things through a sexual lens, but actually a lot of what we'll talk about today will be things that are just distinctly related to your health, but they just so happen to be showing up symptomatic in places which are more intimate and shrouded in that shame, which just is not right. So I'd like to kick off with a section that I'm going to call, Is This Normal? And this is all of those questions that I'm pretty sure most of us will have Googled at some point in our lives. As a doctor, is there any one topic that you see patients coming to you time and time again about which they are really embarrassed to talk about?
One of the things that comes in quite a lot is my discharge normal? And I think that's a really interesting one. Again, stemming back to education around this, because I remember when I was going through puberty and I first started getting discharge and thinking that I had some sort of infection and being like, this isn't right. I distinctly remember being really worried about it. And looking back, I'm like, well, why wasn't that taught? Why wasn't I warned that that is normal and that that's going to happen and that it's okay? And I think that sort of filters into adulthood as well, because we get a lot of people coming in saying like, I don't know if my discharge is normal.
I remember distinctly being, I think I would have been 11, and at the end of a biology class, asking my teacher, who was lovely, why am I getting this white stuff in my knickers?
Yeah. Oh, that's nice that you felt comfortable enough to go and speak to her about it face to face.
Totally. But I definitely had to muster up the courage. And even then,
if
only when I was like 31 and trying to have a baby that I started to understand actually how your discharge changes throughout your cycle.
Yeah, so normal discharge, I think, first of all, it's kind of what is your normal, because everyone's normal will be a bit different. So it's about knowing what you're seeing every day. And if there's a change in that, then that's important to note. But usually it will be like a clear to white discharge. And you might notice that it gets a bit clearer, stretchier and higher in volume kind of around ovulation time. And then after you've ovulated, it might get thicker, creamier. And the thinking behind that, again, is it's more difficult for sperm to kind of travel through. And it helps sort of, if there has been a fertilized egg, it kind of helps that environment as well. It's normal to have a bit of a mild, musky odor. And you can get changes with volume and consistency with contraception as well, and pregnancy, arousal, all of those things can affect it. But if you're kind of noticing a change in the volume, you're getting loads and loads of it suddenly, or you'll notice a change in colour, or it becomes sort of frothy or more smelly in a different way, like a fishy odour, that can be a sign of bacterial vaginosis. So yeah, it's worth just coming in if you're worried, because we can often tell you what's going on the day.
Thank you. Really helpful. I've got a big question here. Are we using the word vagina wrong?
That is a big question. I feel like it went really loud when you said that as well. Which emphasised the importance of the question. Because yes, we are, well, I can't speak for everyone, but I think generally speaking, when people say vagina, they're talking about the outside, or maybe the inside as well. But the vagina is the internal part. So the outside is actually called the vulva. And that would be like everything you can kind of see on the outside, the outer lips, the inner lips, the labia majora, minora, and then the clitoris as well, your urethra, where you wee out of, that is actually all called the vulva. So we should really be saying my vulva, unless you're talking about the vagina, which is the inside bit that leads up to the cervix, like the entrance to the womb.
Okay, petition for everybody here to start talking about their vagina and vulva the right way.
I mean, it's one of those things, isn't it? It's just a kind of colloquial term. But actually, when someone's coming into the clinic, I do have to clarify which bit is sore or which bit is itchy, because the vagina is the internal kind of muscular canal that leads up to the cervix.
I wonder if it's something about the word vulva sounding more scientific, more medical, maybe more of like a and I'm saying this in quote marks for anybody who's listening, a dirty word. I just wonder if people have finally become more comfortable saying the word vagina, and actually to use the anatomically correct term feels a bit embarrassing.
We've probably got used to saying the word vagina now. It doesn't make anyone like recoil, but it shouldn't be like that. It's just the correct, we're just describing anatomy, and we shouldn't feel embarrassed to describe our anatomy and to have the correct language to describe that.
So what does a normal vulva look like? I actually had a message in this morning from a listener who said, please can we normalise larger labias? I feel like I've been living my whole life with shame about the size of mine, particularly going through fertility treatment, where obviously you're basically having to take your pants off in front of people a lot.
So there is no normal. That is the key thing. Everyone's different. There's this amazing British artist called Jamie McCartney, and he did this incredible exhibition where he took plaster casts of 400 women's vulvas and made like an exhibition of all of them next to each other. And it's so interesting because none of them look the same. And I think we've had this probably from porn, really, idea of what a vulva should look like. And that is just not representative of real life. I mean, I can guarantee you it's not, because as a doctor who works in sexual health and I'm examining women all the time, nobody looks the same. It's completely normal to have your inner lips or labia minora bigger, or kind of poking out of the outer lips, the labia majora. That is completely normal and extremely common.
As a medical professional who I'm assuming sees quite a lot of different vulvas and labias on a daily or a weekly basis, are there any words of reassurance that you could offer somebody who might feel self-conscious of what they look like?
Yeah, I think reminding yourself that this insecurity has probably come from society's standards, which are based on nothing. Don't use porn as your standard of what normal is, because it isn't. I don't even really know why that has become the kind of norm in porn either, but it isn't representative and everyone is completely different. I think knowing that, and knowing that if you're going to be going to have an examination, that the person examining you, you're not going to be the first person that they've ever examined, and they are examining you for medical purposes to try and help and treat you. They're not going to be looking at your anatomy and making any judgment on that, because they're there to help, and they will have probably seen hundreds and hundreds of vulvas. So I hope that is some reassurance. But I think just also looking back and understanding that this isn't a you thing. The way that you're feeling is because of society and the things that I said at the beginning of this podcast, where we haven't been given the tools to understand our own anatomy.
I've heard of that exhibition, and I've heard of sites where you can see pictures.
He's got a website with all of the casts and photos. I think it was called the Great Wall of Vagina, and now it's been changed to Great Wall of Vulva, which is ironic because it kind of just goes to show that it's like a society thing, but it has now been corrected.
Kind of a shame, because Great Wall of Vagina is a good little play on words, isn't it?
It is.
But go them for changing it to something that's anatomically correct. We like that.
Yeah.
On the topic of vaginas, although I'm now looking at this question and wondering if it might be actually a vulva/vagina question. One listener has asked, should I buy special intimate wash for my vagina?
No. It's like a knee-jerk response. Please don't waste your money, and protect your vulva and vagina. It's a question for both. It's more the vagina, actually, so your question was correct. Your vagina is self-cleaning, so it's maintained by these great bacteria called lactobacilli, and they help to keep the pH of your vagina. They thrive in that pH as well. So if you start douching or washing that area with soaps, it can just get rid of all of those healthy bacteria. It disrupts the balance, and it's linked to kind of things like bacterial vaginosis, which is an overgrowth of another type of bacteria that can cause copious discharge, smelly discharge and things like that. Please don't use any like perfume products. Please don't use like soaps down there, because it is self-cleaning. The vulva, I would suggest using just water. You can use things like soap substitutes as well if you're someone who's prone to kind of dry skin. Just simple aqueous creams, and they can help with keeping it more moisturized. But please don't use these like feminine hygiene products, because they're not good. They're not good.
Yeah, appreciate that a lot. Another listener has asked, is there a safe or healthy way of managing groin sweat? And I think we should position this first of all as, is sweating down there normal?
Yes, of course it is. It's normal to sweat from anywhere you've got sweat glands, and you've got lots of sweat glands there. So it's completely normal to sweat. I think wearing kind of things like cotton underwear that are more breathable can be really helpful for that kind of thing. And just keeping the area. So if you've been, for example, to the gym and you're particularly sweaty, having a shower after, just so that you're cleaning that area away so that there's not build up.
I definitely have noticed pretty stinky leggings, especially when they're made of sort of synthetic fibres. And I'm sitting here today repping my fully cotton leggings, which are super comfy and definitely not as prone to being smelly. So,
well, I guess, yeah, cotton underwear and also breathable fabrics to work out in, whether that's cotton or another breathable fabric, finding something that works for you so that the area isn't getting as much buildup of sweat and it's able to release the heat.
Makes a lot of sense. Yeast infections. Somebody has asked, I get multiple yeast infections a year. Is this normal, and what can I do?
So, yeast infections, so that is things like thrush, and they can be really unpleasant because you get this change of discharge, you get itching, you get irritation, it can be really painful. What I would suggest, if you haven't already, is going to the sexual health clinic, because one, if you're getting recurrent thrush or recurrent yeast infections, we should probably check the type of candida it is, because you can get different strains of candida, and some of them may be resistant to the over-the-counter treatments that you might get from the pharmacy. We will have a look, see if it actually is thrush under the microscope, and if it is, we'll send off a culture plate and we can check that the treatments that you're using are the right treatments. There are conditions that can mimic thrush and mimic yeast infections. There's a condition called lichen sclerosis, where you can get itching and irritation and it can come and go. But it's really important that we diagnose that, because if it goes undiagnosed, it can lead to problems down the line, including things like vulval cancers. So first thing I'd say is come and have a chat with us in the clinic. If you are getting recurrent thrush, then we can try and start you on a different treatment. It might be that your body just needs a different type of medication for that. But we can also explore whether there's anything else going on. Where I work, we've got a special clinic for cases like this where you'll be seen by one of the consultant experts and they'll be able to make sure everything is being done.
That's great. And I'll also try and put in the show notes a link to where you can find your nearest gum clinic or sexual health clinics. I feel like that might be useful for people. We're moving up to breasts. I feel like maybe similarly to vulvas, people expect boobs to be completely symmetrical. Is that the case?
No, it's not. The majority of people won't have boobs that are the same size. So I think I read a study and it said that 55% of people will have a larger left breast than the right.
Oh.
So most of our bodies aren't symmetrical. Our faces aren't symmetrical. Our vulvas aren't symmetrical. Your breasts probably aren't symmetrical either. So it's completely normal to have asymmetrical breasts. But I think, again, it's about the change. So if you normally have boobs that aren't the same size, that's fine. But if you notice that suddenly one has changed size and one is larger than the other, or you found a lump or anything like that, then that is the thing to worry about and go and see someone about.
And does the same go for your nipples as well?
Yeah, it is. It's the same. So again, if you've noticed any change in your nipples, that is when you should come and have a chat with us, with your GP. I think another thing that people worry about is like breast sagging, or ptosis is the like medical term for that. And again, that is just a normal part of aging. People often worry about things like breastfeeding and whether that is going to impact that as well. There's no evidence to suggest that breastfeeding increases kind of the sagging or the ptosis of your boobs. It's more about pregnancy, actually. So during pregnancy, the supporting ligaments of the breasts can change and that can cause them to sag. But again, that's just a normal part of pregnancy and nothing to do with breastfeeding. So I thought I'd just bust that myth as well.
That is so fascinating. I had no idea. And I think I have said the words, I don't think I want to breastfeed because I would like to not have saggy boobs, which I'm ashamed to have said.
No, I think you're probably not alone with that. But actually, there's no evidence to suggest that. And it is related more to pregnancy.
Fascinating. One listener wrote in and said, can you get eczema on your nipples?
Yeah, you can get eczema anywhere on your skin. And you can get eczema on your nipples as well. It can be quite irritating because it's quite a sensitive area already. And what I would also say is if you've got changes in the skin on your nipple, that you should go and have that looked at, because again, thinking about things like breast cancer, one of the only signs in some people is nipple changes. So please just go and get it checked out.
Final question on this topic is, why do my boobs hurt before my period?
Again, super common. I've had this. I'm sure a lot of people listening will have had this as well. So it's called something called cyclical breast pain, and I think it affects around 70% of women at some point in their lives. It's just to do with the hormonal changes that happen with your normal hormonal cycle. As I've said about all the other things, if that's your normal pattern of your normal cycle, that's fine. But if you've noticed new breast pain that isn't usual for you, then again, go and get that checked.
I feel like, yeah, there is definitely a pattern here, but it's a really useful message to be telling people that, like, know you're normal. And if something deviates from that, then get it looked at. Next section on this is sex. And had quite a few questions on this. I actually feel like I could have written this question. Someone said, I'm 32 and I have a way lower sex drive than when I was 22. Why is that?
Great question. And it isn't just a one answer thing. So We know that testosterone does gradually decline as you get older. There's no kind of cliff edge like it with the menopause, for example. It's just a gradual age-related decline. And having a lower testosterone can mean that you have a lower sex drive. So as you get older, that could be part of it. But actually, it's so multifactorial. So things like stress have a huge impact on your sex drive. And as we get older, generally, things like jobs, kids, families, all of those things might mean that you're a little bit more stressed than you were before. Interestingly, things like relationship duration. So if you've been in a longer relationship, we know that often desire eases as relationships can kind of mature. And that isn't related to hormones at all, and that is completely normal. Also, things like medications. So if you're on antidepressants, if you're on hormonal contraceptions, all of these things can sometimes impact your sex drive. There's no kind of single thing or single reason. It is very common that people feel like, oh, my sex drive has gone down.
One thing that's just come into my head is it's a comment that I've heard quite a lot recently from my friendship group, which is this idea that coming off contraception can mean that you no longer are attracted to your partner. And I think a video did the rounds on social media saying that it is possible to no longer be attracted to the person that you have, built your life with if you then come off contraception. Do you have any thoughts and feelings on this?
That's awful.
I
know. I can't say I've read any studies about that. It's definitely not in the side effects manual of the contraceptions. I mean, I guess being on hormonal contraception affects people in all sorts of ways, and some people get terrible side effects. Some people are absolutely fine on it. But I haven't read anything about that, and I wouldn't worry because it's not a common thing.
I've been with my husband for almost 10 years. I've been on multiple different types of contraception and then no contraception and then lots of different hormones for IVF. And, there have been times where I wanted to punch him because of them, but I think I fancied him throughout. So
yeah, that's great. See, we've got a good example just here, everyone. Don't panic.
This is a brilliant question that we had from somebody, which is about testing for STIs. If somebody is sexually active and hopefully using protection, how often should they be testing for STIs?
When you say protection, do you mean condoms?
Well, let's say someone was being really good and was using like barrier methods every time. Do they still need to be testing for STIs, particularly if they have multiple partners?
Yeah, definitely. So I'd still say you should definitely be getting checked. You're doing the right thing by using condoms because that's the best thing that we've got as protection for transmission of STIs. But it's still a good idea to get checked after new partners, before entering into new relationships and things like that, because there is still a risk of transmission, even though it is very, very small. Yeah, if you're getting new symptoms, then I would suggest coming and seeing us in the clinic, because I don't think there's any harm in doing a sexual health screening. Generally speaking, we say if you've got lots of partners and you're having sex loads, good for you, go and have fun, enjoy yourself. I would say getting checked every 3 months is a good idea if that is the case. And also going and having a chat with your local sexual health clinic about whether things like PrEP, which is pre-exposure prophylaxis, a fancy name for a tablet that you can take to prevent transmission of HIV. It's one of the best things that medicine has created, especially if you're having unprotected sex. And if you're not having sex that much, you're not having loads and loads of partners, I would suggest getting tested before and after every new partner, just so you know your status. And being mindful of the testing periods as well, because if you test too soon after having unprotected sex, then the test result won't be accurate. I've got a video on window periods on my Instagram. You can go and check it out. But just a quick sort of explanation. Chlamydia and gonorrhea, it's 2 weeks. So if you had sex 2 weeks ago, you can test now. HIV is 6 weeks and syphilis is 12 weeks.
So helpful.
One thing you should be getting tested for is HPV, which is part of your cervical screening. Do not skip that, even if you've been in a long-term relationship. HPV can lie dormant, so it can, even if you haven't had any new sexual partners and your partner hasn't, it might get picked up on a test anyway.
And we've got an episode on cervical screening if anybody is listening and thinking, oh shit, I am not up to date on mine. You can have a listen to that. Final question here. And this is one that is very, very close to my heart. is it okay for sex to hurt, even if it's only sometimes or in certain positions?
Yeah, I think that's a really good question. If you're getting any pain, then it's usually your body's way of telling you that there may be something not quite right there. And even if it's only in certain positions, because it might be that there's something in that position that's getting bumped, like, for example, some endometriosis or a cyst, or yeah, Izzy's like me, or even something like a hip problem. It might not be anything sexually related, but it's worth getting that checked out. I mean, even if you go and have all the checks and there's nothing there, no harm done. There are other conditions, for example, vaginismus, where you get kind of tensing of the muscles and pain more at the entrance of the vagina. That might be your body's way of telling you something, and there are things that we can do to help. We see people coming in with this every day, and so we can hopefully diagnose the problem there and then and give you some support with that.
I wish that I had been thinking about what my prior normal had been, because probably for the last 2 years or so I've been having pain during sex, which definitely wasn't there like 5 years ago. And it turned out that was endometriosis. So
yeah, I mean, your journey has been, it just sounds crazy. Like, you've seen so many different people, medical professionals and stuff, and then it was just one person that turned around and said, this sounds like classical endometriosis, and then it was. So I'm really glad that you've got that diagnosis.
Thank you. Yeah, my best friend is a doctor, and she has nicknamed the woman who diagnosed me as the wizard.
Yeah, I bet she's someone who probably sees this a lot, where people haven't had that diagnosis and it's just not been considered. And then after years and years of kind of bouncing from pillar to post, I imagine she's like, this is so obvious, because she probably sees it a lot. I'm just so glad that you saw her and you got everything diagnosed now.
Honestly, so am I. I'd love to go into a little bit about how our bodies change throughout our lives. And I'm thinking here specifically about our 20s, 30s, 40s. And the first topic that I'd like to talk about is weight. I actually felt quite sad recently because I had a friend and she showed me a photo of herself maybe 5 years ago, and she was like, oh God, I've let myself go. And I was like, no, you haven't. You're no longer 27. Like, how does our body composition actually change during this time?
A lot of it is related to hormones. So in your kind of 20s and 30s, you've got like high levels of estrogen, and then as you kind of get older and go through the menopause, the estrogen levels drop. And it's really interesting. There was a study that it did scans on people, and it showed how the fat distribution changed through the kind of few years of menopause transitioning with hormones and things. And so estrogen encourages your fat to be deposited in areas like the bum and the thighs. That's why often women will have a higher percentage fat compared to men, but that fat will be deposited in the bum and the thighs and those areas. And then when the estrogen levels drop, the fat tends to deposit more in the tummy area and viscerally around your organs inside. And so you get kind of a shift in body composition as you go through that period of change of hormones. And it isn't anything that anyone can control. It is just how our bodies work. And I think it can be really difficult because you can do everything under the sun, eating the same things, going to the gym or doing whatever exercise you like to do. And there's nothing you can do because there's that hormonal change that just happens. It is just a natural part of being a woman.
And I think it is, again, it's a societal thing that we're shown this perfect body, and often that isn't realistic. No. But also in terms of knowing you're normal, I can imagine it's really, really tough for women when you suddenly start looking in the mirror and seeing changes. That could be really, really hard to process, but
definitely.
It's normal.
It is. It's completely normal. And I think also the whole skinny talk thing that seems to be coming back now is just so devastating, because it felt like we'd come leaps and bounds from that in, you know, appreciating our bodies and loving our bodies. And it is so sad, because I feel like it's going to be the younger generation that are seeing that, and it's just a cycle that's kind of repeating itself. But this is normal. Our body composition is going to change, and it is part of womanhood, and it should be embraced and appreciated that our bodies are amazing.
By contrast, one listener wrote in and asked, is it possible to be naturally underweight, or am I just underfueling?
Everybody will have a kind of natural metabolism. Some people's metabolism might be faster, some people's might be slower, and you can have like a more natural body weight for you. In terms of underfueling, I guess it's about, your body will be telling you, are you feeling exhausted and tired? Are your periods in a regular cycle? Looking at yourself as a whole is a better way to answer the question of if you're underfueling or not. And I think if you're going to be doing things like intense exercise, long distance running, just being mindful that you need to make sure that you are fueling yourself properly as well.
There's a brilliant creator and sports nutritionist on Instagram called Shan Sek. I would really encourage anyone who might be listening to that question and thinking, oh yeah, that's a good one, to check out her page, particularly if you are quite active, because it's very no nonsense and just has some really, really useful advice on it. We're going to finish with a bit of a quick fire. And this is, should I get it checked? So red is like red flag, get this checked, book in at your bum clinic or your GP. Amber, this was not meant to be a pun based on your name, but when I was explaining this to my husband earlier, he was like, see what you've done there. Amber, keep an eye on it. If anything changes drastically, go get it checked, but it might be fine. And then green is like, green flag, you're fine, this is totally normal, don't worry about it.
Great, let's go. This sounds like a fun game.
First one, bleeding during or after sex.
Red flag, you need to get that checked. That's not good. I mean, it can be absolutely fine, but I don't want you to fall into a false sense of security of, oh, this sometimes happens to me, and therefore it's my normal. There are lots of common things that cause this. There's things called cervical ectropions, which sounds like a scary name, but they're not scary. But also things like infection and cervical changes can cause bleeding as well, including cervical cancer, which is why it's so important to just go and have someone have a look. So yeah, red flag, go get checked.
Yeah. I have had a cervical ectropion before, and it was the source of bleeding after sex.
Me too.
Okay, great. We love that. We like a bit of normalization.
Yeah.
What about bleeding between periods?
Again, I would say get checked as a red flag, because while again that can be normal, especially if you're on hormonal contraception, you can get a bit of breakthrough bleeding depending on what contraception you're on. And sometimes people will get a little bit of spotting around ovulation. But the general rule is any bleeding in between periods can be a sign of something that's not quite right.
Missing periods when you're not pregnant.
Yes. So first of all, do another pregnancy test. Just make sure the timing of the pregnancy test, you've done it at the right time. Missing a period as like a one-off, if you've been sort of unwell, or you've had a big weight change, or you've been traveling, all of those things can sometimes mess up your cycles. And if it's just a one-off, then I wouldn't worry too much. But if you're getting lots of missed periods, or you've got an irregular cycle, or you've gone sort of 3 or more months missing periods, go and see a doctor. So that's kind of a keep an eye in the middly one.
So Amber's giving that an amber.
I'm giving that an amber.
These next ones are going to be on vulval and vaginal health. The first one is a vagina that is dry or itchy.
I would give that an amber again. So if it's just sort of, you notice that it's a bit itchy for a day and then it goes, then I wouldn't worry too much. I would maybe look and see if you've used a new product, or you've got some new knickers or something that are irritating the area. But if it's persisting or recurring, so it's happening again and again, then always worth going to see your doctor, because it might be eczema, it might be thrush, it might be lichen sclerosis. There's lots of different causes and it's worth getting looked at.
Great. A lump on your vulva.
That is definitely a get checked, red traffic light. Most vulval lumps are benign, so you can get little cysts there, which are quite common. But the worst scenario would be that it was a cancer, a sort of malignancy there. Very rare, especially in younger women. But it's worth getting looked at.
Thick discharge.
So, is this a change from your normal? Is the first question. If it is, then I would say go and get it checked, because that's a very common sign of thrush.
Is that the cottage cheese analogy that I feel like has basically put everyone off cottage cheese for the entirety of the first 20 years of the 2000s?
Yes, it is. It does actually look like cottage cheese though.
Oh, don't. Pain during sex.
Red traffic light. As I said earlier, it's usually your body's way of telling you that there's something going on and it's worth just having a look into.
Finding a lump in your breast.
Red traffic light, get it checked. Any new lump anywhere on your body, really, you should have checked. If you find a new breast lump, common things again are benign, things like cysts or fibroadenomas, which are little lumps that can come up that are completely benign, but they should never be self-diagnosed.
Discharge coming out of your nipple.
Again, I would go and get that checked, because it can be, again, a sign of cancer process. It could be an infection as well. So yeah, go and get that checked out.
Pelvic and bladder health now. The first one is being bloated.
Okay, I think this is actually a good one, because it's very common, and bloating that kind of comes and goes, especially, is very common, with your menstrual cycle. But don't ignore bloating, because if you've got bloating that persists for 3 or more weeks, that is a red flag for ovarian cancer, and that can often have no other symptoms. So I would put that in the amber category of like, keep an eye, and if it's persisting, 100% go and get checked.
Leaking urine. So in the less scientific or medical terminology, speaking from personal experience, if I am letting out a bit of wee, either when I'm exercising or when I start laughing, should I get that checked?
I would say, again, keep an eye, because it's usually a sign of your pelvic floor muscles not being as strong as they might have once been. It's extremely common. I think it's around 1 in 3 women will have that at some point in their lives. So yeah, I would keep an eye on it. And if it's still a problem, go and get it checked and have a chat with your doctor.
That's great. I feel like someone only has to say the word pelvic floor and I suddenly find myself having to do a Kegel.
Yeah. And then I'm like, oh my God, I'm doing a Kegel and no one knows.
So weird. Oh, so good. What about pain when you're going to the loo? So pain specifically when you're urinating or having a poo?
Yeah, so go and get that checked. If you're getting pain when you're weeing, that can be a sign of a urine infection, which you don't really want to leave untreated, because it can cause problems further up your urinary tract in the kidneys if it's not treated. And you can also get pain when you urinate as a sign of an STI as well. Same goes for pain when you're pooing. It's not normal to have pain when you're pooing, so you should go and have that looked at as well.
And the final thing is about hormones and body changes. Number 1, facial hair.
Yeah, facial hair is very normal. I think, again, it's a societal thing of you should have no hair on your face as a woman. But I'm pretty sure we all have it. It's largely genetic, whether or not you have more facial hair, less facial hair. But if you are getting lots and lots of facial hair, if it's new or it's kind of rapidly increasing, or you've got other symptoms like acne or irregular periods, then go get that checked, because it might be that you've got PMOS or another hormone related cause. So I'd say usually normal, but if any of those other things apply, go get it checked.
What about your periods changing in your 30s?
Yeah, so I would say keep an eye on that. If you've noticed that your cycles have become less regular, or you're getting kind of heavy or prolonged periods, or you're getting a bleeding in between periods, it might be that you're perimenopausal. There are other causes as well. For example, a thyroid problem. These things can crop up at any point in your life. So, yeah.
Okay. And the final one, low libido.
Keep an eye, amber flag, extremely common. If it's persisting, then go and get checked. But having a think about all those things yourself and thinking, oh, am I really stressed? Is there anything I can do to help that? And then seeing whether your libido comes back, I think is a good place to start. So yeah, I would say keep an eye, amber flag.
Great. I feel like this could be a whole podcast episode of itself, but I would love at some point to do an episode on, what specifically women can do to help low libido. And I think, I've definitely heard from friends, and I haven't tried these for myself, but about a lot of apps which will do kind of audio or female first porn. And I just think there's so much out there.
Yeah.
So potentially, if you are experiencing this, maybe those are all good things to experiment with. It strikes me that you might need to almost get back to feeling sexy in yourself before you can feel like that with somebody else.
100%. Yeah, I completely agree with that.
Amber, I have loved this conversation. I feel like I've learned so much, and I just can't wait to get it out there because I know that it's going to really benefit people. So thank you so much.
I've loved chatting away with you. It's been really fun. I love chatting about all this stuff, and I hope that people find it useful. If there's ever anything people want more answers on, hit up my DMs and I'll make a video on it.
And we will, of course, put your profile and your other links to your podcast, for example, into the show notes too, so people can find you there. Definitely give Amber a follow.
You can find me on Instagram and TikTok at doc.ambs, and also podcast Taboo Topic Pod, which is on Instagram, Spotify, YouTube and Apple Music.
Love it. I really hope that we can continue to chat and learn from each other. Well, mainly me learning from you.
Thank you so much for having me.
Such a pleasure. Have a great rest of your day.